5 seconds, Dr. Tracy. Have a great show.
For years, I've been on television as an expert. Once you see the sausage being made, you understand that the news isn't newsing. They are creating narratives. They are feeding us what they want us to know. With this podcast, I'm taking on the 6 media conglomerates that control what you know, and I'm putting information you can use into the world. What we don't know is the weekly, narrative-free, pundit-free, commentator-free zone. I'm Dr. Tracy Pearson, your host. Let's do a show. Hi, folks. A brief programming note is in order. This week on What We Don't Know with Dr. Tracy, you will hear the first installment of a 2-part interview with Dr. Sharief Taraman, a pediatric neurologist. It's that good, and it is that important. Hi, I'm Dr. Tracy Pearson, and if this is the first time you've heard or seen What We Don't Know, welcome. If you're a regular listener, welcome back, and we're glad to have you back. In this episode, I talk with Dr. Sharief Taraman, a pediatric neurologist who's on the cutting edge of autism treatment. We discuss autism, challenges facing the treatment of autism, and how technology is helping to improve outcomes. Now, autism is a ubiquitous word, but do you really know anything about it? If you know nothing about autism, or if you are a parent struggling to obtain treatment for your child, you'll really want to listen to what Dr. Taraman wants us to know. It's my pleasure to welcome to the show Dr. Sharief Taraman. Thanks for joining me and helping to put substantive information into the world. Before we dive into our conversation and what we need to know, could you take a moment to share a bit about yourself and your journey?
Excellent. Thank you so much for having me, Dr. Tracy. It's a pleasure to be on the show. My background is I'm a pediatric neurologist, and I also have a board certification in something called clinical informatics. So that's how we use information and technology to improve healthcare outcomes. I started my career at Children's Hospital of Orange County and University of California, Irvine, and then made my way into actually med device industry and currently work for a company called Cognoa, where I was the chief medical officer and now the CEO.
Terminology is important, and words like autism are often used as derogatory and self-deprecating ways of describing people. And the word has nothing to do with the disorder when they're being used that way. Because my goal is to be informative, I really want to start with the basics. So what is autism?
Yeah, it's a great question. And I think part of the challenge of why that occurs is that we're kind of hodgepodging a lot of things together and calling them autism. And so that's sort of a disorder within the medical community, if you will. Really, though, fundamentally, we base it on something called DSM-5 criteria. So there's a manual that we use in healthcare to kind of describe things. And the description of autism in that manual is challenges with communication to a point that it actually causes significant ability to communicate in the current neurotypical world. Challenges with usually either sensory, repetitive, or what we call stereotypic behaviors. So those would be what, again, neurotypical people find as peculiar hand movements, for example, or peculiar interests, if you will. But again, the challenge with that, in order for it to be considered a disorder, is it actually has to impair the ability of the person to function in the world. And so that constellation of signs or symptoms is what we call autism.
Now, what is the difference then between developmental delay, developmental disorder, and autism? And I don't expect you to sort of recite the DSM criteria, but I think that it'd be helpful for people to understand the difference between these 3 words or these 3 phrases.
Yeah, absolutely. And so the challenge of this is actually that they're all so interrelated. And again, this is where a lot of that confusion or maybe lack of clarity comes into play. And so as children are growing and developing or growing up, they're supposed to do certain things at certain times. Like we expect a 2-year-old to be able to have 2-word phrases, let's go type phrases. And if they don't hit that as a milestone, then we start saying, oh, look, language is delayed. So we see children with autism having developmental delays. Speech and language is actually one of the primary concerns that show up as parents or teachers or caregivers are taking care of kids. And one of the challenges that happens in the current medical system is that people don't recognize that it's more than just an isolated speech delay, and that there's those repetitive or maybe those stereotypic or maybe these sensory issues that I mentioned before. And so what happens is if you don't recognize that, those kids unfortunately get a late diagnosis of autism. But within the umbrella of what we call developmental delays, there's a bunch of different conditions. So again, speech and language disorders, autism. We also see things like ADHD in that category, learning disabilities or intellectual disabilities. So problems understanding how to, let's say, read, for example, is a reading disability. So anyways, there's a whole cohort of things that fall under developmental delays, developmental disorders, and autism is one of those.
That's really helpful to understand. Now, you talked a little bit about this, but I want to sort of dig a little bit deeper into it. What are some of the most common signs of autism that parents should be aware of, and when might they appear? When should they be really alert for seeing the potential for having autism?
I'm really big on trusting your gut instincts as parents. So most parents recognize something's going around 14 months, although sometimes it's even earlier than that. So sometimes as young babies, parents who ultimately determine or find out that their child has autism or is autistic, and I'm going to use those a little bit interchangeably. There's a little bit of push and pull in the community about how to describe autism and people with autism or autistic individuals. So I'll use those interchangeably. Forgive me if I don't do exactly like you like, but I'm doing my best, and it's with good intentions and a good heart. But parents recognize, they'll say, hey, my baby was really irritable, or my baby was fussy. They'll sort of have that history sometimes. And then around 14 months, they start recognizing speech delay is a big one, as I mentioned, or just other like sensory issues. Like we see kids on the spectrum or individual on the spectrum sometimes having what we call either a hyper, meaning an exaggerated increased response, or a hypo, decreased or blunted response to things. So a lot of times, for example, parents will tell me, I noticed that my child doesn't like to be touched. They're very sensitive to tags, clothing, things like that. Or they like really, really hard touch. So when they hug you, it's like really tight, and they like that pressure, or they like weighted blankets. So things that are seeming like a little bit outside of what we would consider, again, that neurotypical bounds in terms of what is a normal sensory perception, if you will, is a big marker that parents notice for kids with autism.
How does the spectrum of autism vary among individuals, and why is that important for us to understand?
So this is actually key, and I think this actually goes along to a lot of the hypotheses around neurodevelopment and what ends up creating that presentation of autism. And again, we don't fully understand this. There's a lot of really good work in this space. But again, I think one of the challenges is that we're calling lots of things autism, and those things that we're calling autism have many potential reasons for them to develop. But ultimately, what we see in some of the most prominent studies is that the brain, when it forms, it has a certain number of neurons. You're born with a certain number. And then what happens is each of those neurons, which are these brain cells, connect with another brain cell. And if you think about it, the more connections I have, the more I can process information. But it's not forever and ever and ever. It actually gets to a point where if you're over connected, it actually can cause some dysfunction in the way that you process information. So a lot of times what we think about with this increased neuroconnectivity, which was actually shown on studies of like the front part of the brain, or what we call the frontal lobe, in individuals with autism or autistic individuals, is that they're hyper-connected. They have more connections than a neurotypical person. And what can happen is that as information is coming into the brain and it's trying to get processed there and then sent to another part of the brain to process again, it kind of gets stuck. So I think a really good example, some of the older kids that I've taken care of, they'll tell me, hey, Dr. Taraman, I cannot focus in class because I can hear the fluorescent light bulbs in the classroom and they're so distracting. I can't pay attention to the teacher. And as a neurotypical person, I'm like, fluorescent lights, those shouldn't make noise. But then if you really, really focus, you might be able to hear it. So again, that signal to noise ratio can create dysfunction in their ability to, pay attention in class, as an example. And so that dysfunction, then we need to figure out, like, okay, can I help them as an individual suppress or turn down the fluorescent light noise? Or the alternative is, hey, let's make an accommodation. Let's get rid of the fluorescent lights out of the classroom or turn them off, as an example.
So you use the term neurotypical and neurodivergent, and you also describe some things where I sit here and I think, well, I don't like tags on my shirt. Those are uncomfortable. I don't like tight shirts. But as far as I know, I don't have autism. I'm not on a spectrum, although maybe my husband might disagree at times. Seriously, there are certain things that I do, and I think that everybody sort of sits there and thinks that way at times. As I said, it's often used as a self-deprecating word. Can you talk to me a little bit about what is the difference between neurotypical and neurodivergent?
I mean, realistically, honestly, we're all neurodivergent, right? I mean, it's actually kind of a really cool and beautiful thing. And I think this is where we see in work and industry and education, actually having people from different backgrounds that think differently and experience the world in a different way can be very powerful. And it's actually one of the probably most beautiful things that drives humanity and human innovation is this divergence in thought patterns, right? If everybody thought the same and experienced the world the same, right, we'd probably be pretty stagnant. I think the biggest challenge here, and the reason that it becomes a medical thing, is when those features create dysfunction, right? And I think maybe taking something that's maybe a little bit better understood, maybe, is something like attention deficit hyperactivity disorder, right? So a lot of people, in the same way you were saying, use autism as maybe a deprecating term, right? A lot of people say, oh, I have ADHD. Well, maybe not, right? You may be hyperactive and you may be inattentive, but until that causes a dysfunction in your ability to, do well in school or do well in the workplace, it's actually not a dysfunction. And in fact, all of these things, including autism, kind of can actually be a little bit of a superpower. So as I mentioned, again, maybe let me take a different example and then I'll come back to autism. You may have obsessions and compulsions around organizing things. And so you have obsessive compulsive traits. And that actually may be a really good superpower to have as a physician, right? You're obsessive about, like, did I wash my hands? And am I, going to make sure that the patient gets all the things that they need, right? That's not a dysfunction. That's a superpower. You want that. In the same way, I mean, many of my patients, more than the quote unquote, again, neurotypicals, I'll go to this again, have superpowers. We actually see the rate of savants in autism at about 3% versus 1% in the general population. And to your savant kind of comment, or maybe like typical depictions of individuals with autism in the media, that Rain Man character, right, was able to calculate things, instantaneously, which most neurotypical people don't do. And I like to use an example of one of my patients who loved to listen to the news and weather in the morning. That was sort of where they would go. And they memorized literally every street in the United States and every intersection. And so you can say, if I'm driving westbound on Michigan Avenue and I'm heading from Detroit to Chicago, they'll tell you every street that Michigan Avenue intersects with.
Wow.
I don't have that memorized, right?
So we understand now what autism is and the differences between some terms. I know that there's a lot of talk about this, but we're seeing a lot more diagnoses of autism. And I guess I'd like you to discuss or elaborate on the myths surrounding the causes of autism, what research says about them, and why we're seeing more diagnoses of autism.
Yeah, so the rate of autism, most likely when the next official numbers come out, is going to be 1 in every 26 kids. The last official numbers from the CDC were 1 in 36. So you can understand, right? Like people are going, what's happening? Why is there this increase in autism? It's interesting though, again, going back to, what causes autism? We don't actually fully know. We have some really good genetic markers of autism. And if you have this gene mutation, you're likely to have autism. But the interesting thing is that not everybody who has that gene mutation has autism. They don't all present with autism. And a good example of that is a condition called tuberous sclerosis, for example. So much higher rate of autism, but not everybody who has tuberous sclerosis has autism. Another kind of interesting feature is there is actually a maternal antibody related autism. So we can see, and it's well documented, that sometimes something happens, it creates an inflammatory response. There's autoantibodies that from the immune system of the mom that pass over to the infant that disrupt the way the neurons are connecting. And that's a type of autism. And we think that maybe happens in about, 15% of autistic cases. So again, there's all these different factors. There's a lot of work that's being done around, gut and gut biomarkers, and it's fascinating. There's also really interesting work that's being done where we actually see potentially the media type stuff that we're exposing kids to. So screen time, maybe even just huge amounts of information, putting genetic pressures to increase connectivity of the brain. So we can see kids who use lots of screens early on, that actually changes the way that their neurons are being connected. Now, whether that causes autism, I don't know. We don't know. But it is a pretty interesting thing that's being discovered, that the more a child uses screens, especially the younger they are, the more that they have challenges with socialization, which we said in the beginning was one of the core features of autism, right? They may end up having maybe potentially environmental pressures that increase neural connectivity because they're getting hit with all this information. And the brain may say, well, I should make more connections to manage that. But if you overshoot, then it causes dysfunction. Again, that's a hypothesis, not proven. So don't quote me on that one. But it's interesting because, again, there's so many things that are out there and we're all calling them autism. And then all of these different, what we call etiologies or potential causes for autism are all mixed in there. And so it's hard to dissect them out.
Can autism develop later in life? You were talking about screens and that as a hypothesis. Is it something that can develop later in life in adults, or is it primarily isolated to children? That's where we're seeing it as being the genesis. Hi, this is Dr. Tracy. I am such a tease. If you want to hear the rest of the episode, join me over on Patreon at Tracy Explains. There are 4 great membership options. See you there.